The Amarillo Public Health Department says the vast majority of COVID patients in Amarillo hospitals are unvaccinated, but some vaccinated people still get sick enough to be put in the ICU or even on a ventilator. Thanks for joining us tonight. Andy Justice has this evening off. Tonight, KAMR Local 4's Kaylee Green hears from a local health official to break down the data and explain how the vaccines are working, even as the Delta variant hospitalizes more people. Facts, not fear. Topping our news tonight at 10.
Nearly 7% of COVID patients in Amarillo hospitals are vaccinated, so why are they still getting sick? Dr. Todd Bell, an associate professor of pediatrics at the Texas Tech University Health Sciences Center, says we should remember that COVID vaccines don't entirely prevent infection.
So they're still actually very effective, but they're not 100%. So the more people that we have that get infected in the community, if we have 1,000 people infected, a 90% protective vaccine still means we got 100 people that are going to end up in the hospital even though they're vaccinated.
Also, those who are at the greatest risk from the virus are the most likely to have been vaccinated.
Compared to someone who was healthy and vaccinated, that those folks are going to be at greater risk of ending up in the hospital.
Dr. Bell says over time, as vaccinated people make up a larger portion of the population, the percentage of vaccinated people hospitalized for COVID will increase, but the total number of hospitalizations will decrease.
We could theoretically think that if 100% of our population was vaccinated, we'd only have 10% of the number that we currently have that are in the hospital. But of those 10%, 100% of them would be vaccinated. If people are vaccinated, that our hospitalization rates go down, then that tells us that the vaccines work.
But less than half of our population is vaccinated.
Mathematically probable that almost everybody in Amarillo is going to either be vaccinated or is going to be infected with the virus over the course of the next few months.
He says our low vaccination rate means more people are being infected with COVID.
And those people that are getting infected are the ones who are ending up in the, and are unvaccinated for the most part of those, are the ones who are ending up in the hospital. So the low vaccination rate directly corresponds to the high strain that we have in our ICUs.
Dr. Bell says some vaccinated people will still die from COVID, especially if they have other illnesses or a compromised immune system. He urges those at risk to get their vaccine booster shot as soon as possible. Live in studio, Kaylee Green, KMR Local 4 News. Jackie.
Kaylee, thank you. Dr. Bell also says the best way to stay safe is to layer your protection by getting vaccinated and wearing a mask for the time being.